Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today, we're going to be talking about basic care and comfort. Basic care and comfort is around 10% of your Nclex, but you really have to, well, first of all, you have to pass every section. But basic care and comfort is one that a lot of people who fail Nclex fail. And it's super, super fundamental. And the questions often are not things that you necessarily study for because they seem so simple and so obvious. So I want to go through these to make sure that you're ready for these fundamental types of questions that you can get that you may not have focused on in your study effort, and you can still get them right when you take your NCLEX. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. You know that this channel is part of the greater Clinic Review organization, and we are committed to helping you pass NCLEX. You can take our 21 plus hour NCLEX review at clinicreviews.com. It is taught by the GOAT himself, Mark Klimek. He's phenomenal. He started Clinic Reviews over 40 years ago. He's still going strong. Any rumors to the contrary that you've heard are absolutely false as of April 2025, almost May 2025. And this channel is free for you. We don't cover the things on this channel that we cover in the Clinic Review. And you may say, well, then what do you cover in the Clinic Review? We cover a lot of stuff. There's a ton of stuff I don't cover on this channel. And you can get that as part of the online on-demand review. We also have a streaming service, and we have small group tutoring. I do teach as part of that small group tutoring. It's next gen. We do next gen stuff there, which is why I don't cover it here on the channel. Okay, let's go ahead and get started. Now, I told you basic care and comfort. These are not going to be high level questions. These aren't going to be about first or heart blocks. These aren't going to be about heart failure, right? These are making your patient comfortable and managing their basic problems in a way that's safe and comfortable. Okay, basic care and comfort. There's a lot of people, actually, I find, that who fail NCLEX, who fail this section. Remember, you have to pass all the sections in order to pass NCLEX. And when I look at people's, you get if you pass, I think you get the same thing, but nobody looks at it if they pass because it says they passed everything. If you fail, you get a form that says which sections you did not achieve passing on. So you have to get passing on all of them. If you get below passing, you didn't do well at all. If you get near passing, you were this close to passing that section, and you have to have passing for everything. And there's like 11 sections, 10 or 11 sections. So basic care and comfort is one that I often find people fail. And I think that's because they weren't as prepared for it. They spent all their time studying this high level stuff, and they didn't necessarily focus on the basic care. And so I want to focus on that today. These are not rocket science questions, but you absolutely have to know them to pass. So let's go ahead and practice doing these. Remember, you're learning how to think, okay? I'm not saying you should have just studied this information. This is basic care and comfort. This is basic stuff, but you have to think like a nurse in order to pass it. Okay, let's go. A client with an indwelling urinary catheter reports bladder spasms and leaking around the catheter. Which action should the nurse take first? Check for kinks in the tubing, administer prescribed antispasmodic medication, increase the catheter irrigation rate, or encourage the client to perform pelvic floor exercises. This is one of those questions that is as basic as you can get, basic care and comfort. Fundamental does not necessarily mean easy. It just means fundamental. And certainly managing urinary catheters is fundamental. So what do you take first? You say, what do I do first? First is different than best. First means I can do all of them if I want to, but I have to know which ones I would do first. Okay, so they're having bladder spasms and leaking around the catheter. Check for kinks in the tubing. That seems like a good thing to do. Administer prescribed antispasmodic medication. That also seems like a good thing. So I'm going to say, which would I do first? Would I check for kinks in the tubing and then administer prescribed meds, or prescribe meds and then check for kinks in the tubing? I go, I got to check for kinks first. So I'm going to cross off B. Increase catheter irrigation rate. I didn't even know we had a catheter irrigation. So I'm going to cross that one off. Encourage the client to perform pelvic floor exercises. I mean, they've got an indwelling urinary catheter. that does not seem like an appropriate intervention for indwelling urinary catheter. So I'm going to go ahead and pick A. I think if you had been stuck between two, it would have been between A and B. So for our first question, these are key words in the question. Pay attention to the key words in the question. First is a key word. The two that you like best, say I'm going to do this first and then this, or I'm going to do A first and then B, or I'm going to do B first and then A. A postoperative client complains of incision discomfort. Which non-pharmacological intervention should the nurse implement first? Another first question. Guided imagery, positioning with pillows for support, encouraging deep breathing exercises, application of a warm pack to the incision. Post-op client complains of incision discomfort. Okay, non-pharmacological. These are all non-pharmacological, so that's fine. Incision discomfort, guided imagery. Okay, sure. Positioning with pillows, yes. Encouraging deep breathing. Does that help with incision discomfort? I don't know of deep breathing exercises helping with incision discomfort. I've never done that before. I'm not going to do it for the first time on the Nclex, so I'm going to cross off C. Application of a warm pack to the incision. Warm packs are not for incision comfort. We don't do that. That doesn't help with discomfort. You can use it for muscle aches and pains, but not for discomfort of incisions. So I'm going to cross off C and D. So what do I want to do first? So I would do guided imagery and then position with pillows, or I'd position with pillows and then guided imagery. Well, it seems like I would position with pillows before I did guided imagery because I want to see if I can do the least difficult thing first. Positioning is the most basic, the least problem, the thing that requires the least teaching. So I'm going to go ahead and do that first. First is the key word here. A client on continuous enteral tube feeding has a gastric residual volume of 220 mils. What is the nurse's priority action? So here we have a best question. So it's not first, it's best. What's the best thing to do? They have a continuous enteral tube feeding. So enteral tube means it's going through the GI tract. Parenteral means it's going through the vascular system, but enteral means it's going through the GI tract. And it's they've got a residual volume. So they've got this continuous tube feed going, and they have over 200 mils, which is more than what I would really like. This is why we keep people's head of the bed up a little bit so they don't aspirate, because they're going to have some residual volume in there, but over 200 is a little bit high. So what do I want to do? Hold the feeding and reassess residual in 1 hour, maybe. Dilute the formula with sterile water. No, that isn't necessary. We don't ever dilute the formula. It's sent up at the formula is sent up the way they want it to be done. So I don't like B. Switch to bolus feeding schedule. I don't have the authority to do that. Elevate the head of the bed to 45 degrees. Okay, I like that one. So both A and D are good options. Okay, so let's say because this is a best question, so I can only do one thing. So I'd hold the feeding and reassess the residual in 1 hour, but I would not elevate the head of the bed to 45 degrees. So what's the benefit of elevating the head? Because I should have it at probably 30 degrees, right? So I've got it at 30 degrees, like here, and I'm going to elevate it to 45 degrees. What does elevating it to 45 degrees do? Elevating it to 45 degrees allows gravity to empty out the stomach. Okay. So I like that. If I hold the feeding and assess residual, it means I'm stopping the feeding. Well, they're supposed to be getting it continuously. I can hold the feeding for an hour, but so I'd hold the feeding and reassess, but not elevate the head of the bed. Or I would elevate the head of the bed, but not hold the feeding and reassess in 1 hour. So 220, if it were like over 500, I would definitely hold the feeding and reassess residual in 1 hour. That's really a lot. And they're high risk to aspirate with over 500, probably even over 400. I would do that. But over 220, that's not really high enough for me to be so aggressive in holding the feeding. So I'm going to go ahead and elevate the head of the bed 45 degrees, because if I can only do one thing, the residual is not high enough for me to hold the feeding. Okay. Now, different books are going to probably give you different numbers on what the absolute number is for holding the feeding. I would probably say be safe, and I would say probably over 400. Nclex is not about testing on the edges, so they're not going to test like 150, 200, 250 as holding the feeding. They're going to give you something like 450, 500, 600, and you're going to go, okay, I know I have to hold the feeding now. When preparing a client for nasal gastric tube irrigation, so they have an NG tube and we're going to irrigate it. The nurse's most important priority is to what? So most important, this is best. We have to do this one thing. It's not a first question. Use at least 30 mils of sterile water per irrigation. Instill solution rapidly to clear the tube. Verify tube placement prior to irrigation. Clamp the tube for 30 minutes afterwards. All right, irrigation. They have an NG tube irrigation. So which of these answers do we like? Use at least 30 mils of sterile water per irrigation. Doesn't have to be sterile. It can be, it doesn't hurt anything, but it doesn't have to be. So I don't see why doing sterile water when it doesn't have to be would be a priority. I don't like A particularly. Instill solution rapidly to clear the tube. Actually, instilling rapidly can make people feel really sick to their stomachs and very nauseous. You're actually always supposed to instill by gravity. So I don't like B at all. Verify tube placement prior to irrigation. Well, we absolutely have to do that. Clamp the tube for 30 minutes afterwards. Well, what's the point of that? Clamping the tube is something you do when you're giving medications because you don't want to suck that back out. But for just irrigation, all we're doing is trying to keep the tube clear so you don't have to clamp it for 30 minutes afterwards. So this is an easier one because there's only one thing here that we would do at all. The other three you don't even do. So this is a little bit easier. But what I want you to understand is that when you're reading a question like this, and you might say, well, I don't know what's most important, you can become confused as to what the right answer is. When you're in a high stress situation, you have a moderate level of anxiety. It's more difficult to make good decisions when you have a moderate level of anxiety. Low anxiety actually helps you focus. Moderate anxiety makes it harder to make decisions. And so what you have to do in order to, first of all, lower your anxiety is you have to go in with a plan. You have to go in confident. You have to have a plan. This is how I'm going to handle questions that I don't necessarily know the answer to. I'm going to think through it. I'm going to use clinical reasoning and common sense. That's why I say so often in my videos, clinical reasoning and common sense, clinical reasoning and common sense. It is more important that you use clinical reasoning and common sense than it is that you know everything, because first of all, you can't know everything. And second of all, the majority of the questions on the Nclex are going to be answered by using clinical reasoning and common sense. A client's family requests that you bathe and prepare the body immediately after death. Which statement by the nurse is most appropriate? I'll begin as soon as I finish paperwork. We need to wait for the funeral home. Would you like to assist with the postmortem care? It's hospital policy to wait an hour. So none of these are things that I memorized. None of these things I necessarily studied. And so what I say to myself is this is clearly a common sense and clinical reasoning question. I wasn't supposed to memorize anything. I'm just supposed to use my common sense. So we have a patient that's died. The family says, will you take care of the body, right? Will you do this for my loved one? All right. Is it appropriate to say I'll begin as soon as I finish paperwork? That is not a therapeutic statement. I just don't like it. I mean, is it wrong if you say that in clinical? Like you might say that in clinical, but it's not therapeutic. And I don't want to pick an answer on the Nclex that's not therapeutic. We need to wait for the funeral home. Well, that's not true. We don't wait for the funeral home to do postmortem care. So you should know enough about postmortem care to know that it is the nursing responsibility to do postmortem care. We don't have to have anybody tell us to do that. So B is false. Would you like to assist with postmortem care? All right. Well, they're asking that I bathe and prepare the body. Would it be appropriate for me to ask if they would like to assist? I mean, they can if they want to. I've never asked a family if they would like to assist, but I'll leave a question mark next to it because there's nothing really wrong with it. It's hospital policy to wait 1 hour. Well, that's not true. That's not true. There's no hospital anywhere that has wait an hour to do postmortem care. So C is not wrong. A, B, and D are all wrong. C is not wrong. I've personally never said it, but it's not wrong. And it addresses the request. It doesn't say, hey, you got to wait for me to be ready. It doesn't say you got to wait for the funeral home, which are all untrue. So I'm going to pick C. Now, does that mean I should always ask people, family, if they want to help with postmortem care? No, that's not what it's saying. It's saying this is the most appropriate statement out of these 4 statements. This is most appropriate. Remember, the right answer is the right answer because of the other answers. A bedridden client complains of back and heel pain during turning. Which comfort measure should be implemented? A bedridden client complains of back and heel pain. Okay, they're bedridden. Place sheepskin under pressure points. Massage bony prominences every 2 hours. Apply cold packs to the heels. Keep client on a firm mattress. Okay, so back and heel pain, they're bedridden. Place sheepskin under pressure points. That's fine. I can do that. That's appropriate. Massage bony prominences every 2 hours. No, you don't ever massage bony prominences. Causes friction. It can break down the skin more. Apply cold packs to the heels. Don't do that. It vasoconstricts. It decreases blood flow. It's not going to help. Keep client on the firm mattress. We actually want to have a mattress that disperses their weight equally. So that would be a specialty mattress. It might be an air mattress or something, but it's not necessarily firm. It's not really about the firmness of the mattress. It's about the displacement of the weight. So I don't like D. So I don't like B, C, and D. Now, I'll be honest, placing sheepskin under pressure points was not the answer I was looking for. But the right answer is the right answer because of the other answers. And placing sheepskin under pressure points is totally fine. I can do that. That's not a problem. So because the other answers are all clearly wrong, I'm going to pick the only answer that makes any sense in this situation. A client receiving bolus gastric feedings begins to cough and develop dyspnea. Now, the first thing that comes into my mind is they aspirated. That's my first thought. What is the nurse's priority action? Priority means you have to do this one thing. You must do this one thing. Auscultate lung fields. Well, I would like to do that. Check gastric residual volume. Maybe reposition in semi-Fowlers. I mean, they should already be in semi-Fowlers. Stop the feeding immediately. Okay, I like that. Okay, so I like A and I like D. I'm not sure about checking gastric residual volume because it's a bolus gastric feeding. So if you do a bolus, residual volume is going to be whatever you just put in the stomach because it's got to empty, right? So we really don't do bolus feedings after we've bolused it. So let's see. I would do A but not do D, or I would do D but not do A. I would auscultate lung fields but not stop the feeding. Oh, I have to stop the feeding. Or I would stop the feeding but not auscultate lung fields. I really want to auscultate lung fields, but I have to stop the feeding. I have to do that. A client is due for morning bowel care. So I don't know what that means, but it's a vague question. Which intervention should the nurse perform first? So this is a good example of a very vague question. I'm not exactly sure what they're talking about, so we're just going to have to answer it generally. What would I do first? Administer prescribed suppository. So maybe bowel care suppository. Provide privacy and drape the client. Assist the client left lateral Sims position. Explain the procedure steps to the client. Well, I would do them all. So what would I do first? I would think that I'm not going to administer the suppository is going to be last. Privacy and drape the client. I like that one. Assist the client to the left lateral Sims position. I like B and I like D. So I'm going to provide privacy and drape the client and then explain the procedure, or I'm going to explain the procedure and then provide privacy and drape the client. So if I use clinical reasoning and common sense, I would explain the procedure before I provide privacy. Now, you might say, well, I'm not going to explain it in front of other people. I don't think that's what privacy means in this case. I think privacy means physical privacy to do the work, like covering them, right? So I would want to explain the procedure. I don't want to just go in and start draping them. And they're like, what are you doing? And I'm like, hold on, let me finish draping you and then I'll explain it. That doesn't make much sense, right? So I'm going to explain the procedure first. A newly admitted client has an NG tube for decompression. So that means it's to suction or to drainage, to decompress the GI tract. Which nursing action most effectively maintains tube patency? So it's nice that we have decompression, but the question is specifically asking about tube patency. Irrigate with 30 mL normal saline every 4 hours. Keep suction at maximum continuous. Clamp the tube between irrigations. Flush with air after irrigations. So we're specifically asking about tube patency. So irrigating the tube will help maintain tube patency. Well, that's true. Keeping suction at maximum continuous will help maintain tube patency. You know, it might, but we don't ever put it at maximum. That can damage the wall of the stomach. We don't do it. We usually keep it at low continuous. So that is a fact that you need to know. We keep it at low continuous. So I'm not going to choose B. That's just wrong. Clamping the tube between irrigations will help maintain tube patency. That doesn't make any sense because we're trying to decompress it. So why would I do that? No, that doesn't make any sense. Flushing the air, flush with air after irrigations will maintain tube patency. Flushing with air is just going to give them gas and burping. That's not going to help maintain patency. So the only answer that makes any sense here is to irrigate it every 4 hours. Now, you may say to me, Sharon, I could have gotten that right without doing all this. You might have, but remember, when you're taking Nclex and you're at that moderate level of anxiety, it's harder to think clearly. You have to go in with a plan. How am I going to pass Nclex even when I haven't necessarily studied for this question? Because what most people's plan is to go in and recognize the answer and pick it. That's most people's plan. You need to have a plan of when you don't know what the answer is and you haven't studied it. And you may go, oh, I would know this. You might, but remember how you feel when you took tests in school and the stress levels you felt, or if you've taken Nclex before and you remember how anxious you were when you took it. So you need to have a plan. A client nearing end of life is restless and moaning. Which non-pharmacologic measure should the nurse try first? So non-pharmacologic and first. So this is end of life, basic care and comfort very much applies to basic care and comfort. Offer family photos for comfort. That's non-pharmacologic. Provide gentle hand massage. That's non-pharmacologic. Dim lights and reduce noise. That's non-pharmacologic. Position small pillow under their head. That's That's non-pharmacologic. All right. Which ones do I like? Well, I don't. They're restless and moaning. I don't see how positioning a small pillow under their head is necessarily going to help. Offer family photos. Restless and moaning. I mean, it seems like they're uncomfortable to me. So I don't really, there's nothing wrong with offering family photos, but I don't really know how that's going to help provide pain relief. Like it just doesn't make a lot of sense to me. So I'm going to cross off A and D. So providing a gentle hand massage is fine, or dim lights and reduce the noise. So this is a first question. So I would provide a gentle hand massage and then dim the lights, and then provide a gentle hand massage. I need to dim the lights and reduce the noise first. That's a very well-known, reducing stimulation is a very well-known intervention for providing comfort for patients. And so I'm going to pick that one. I'm going to do that one first. A client with diarrhea reports abdominal cramping. Which bowel elimination intervention should the nurse prioritize? So prioritize means I'm going to do this one thing, diarrhea and abdominal cramping. Encourage intake of bananas and rice. Offer an over-the-counter antidiarrheal. Apply a warm compress to the abdomen or increase oral fluids with electrolyte solution. Okay, I like let's see, reports for diarrhea. I don't like C. I've never done a warm compress to the abdomen for diarrhea. That doesn't make any sense. Oral fluids is good because you rehydrate them. Over-the-counter antidiarrheal, prioritize. I don't know that I would prioritize a medication. It just seems like for basic care and comfort, I'm looking for non-pharmacological. It doesn't say non-pharmacological, but it just seems like that might help. Encourage intake of bananas and rice. I mean, I guess, could that help with diarrhea? Bananas and rice, it's like a low residue, gentle diet. I mean, it's a pretty common diet for people with GI distress. They have abdominal cramping. So, okay. So I'm going to do, well, let's do A, B, and D, because I'm just not sure. Now, I really am sure, right? I know what the right answer is. Okay. I'm teaching you how to think. So if this is a priority question, it's a best question, I would encourage intake of bananas and rice, but not offer over-the-counter antidiarrheal. Or I'd offer over-the-counter antidiarrheal, but not encourage intake of bananas and rice. I mean, they have diarrhea. It doesn't tell me how much. They have abdominal cramping. So I kind of like A better because of the abdominal cramping. So I'm going to cross off B. All right, now I'm going to compare A to D. I would encourage intake of bananas and rice, but not increase oral fluids with electrolyte solution. Or I'd increase oral fluids with electrolyte solution, but not encourage intake of bananas and rice. Well, they have diarrhea and cramping. I have to. It's like fundamental that people with diarrhea have to stay hydrated, and they're also losing electrolytes in their stool. So giving them an electrolyte-rich solution is really super fundamental. So that's the thing that I have to do. The others are C, I wouldn't do. I mean, unless they told me they wanted it. If they want it, it's not going to hurt them, but it's not my priority. A and B are both great. I can do both of those, but I have to maintain their hydration status. I have to. And I've seen this as the right answer with this question before. Like, it's worded very differently. A lot of times it's worded with a child having diarrhea. But what they want to know is that you understand that a priority intervention for anybody with diarrhea is to maintain their hydration. A client on continuous tube feeding has diarrhea. The nurse's first action, so it's not best, it's first. A client on continuous tube feeding has diarrhea. Their first should be slow the infusion rate, change to fiber containing formula, administer prescribed antidiarrheal, or check for recent antibiotic use. Continuous tube feeding has diarrhea. So we got to use common sense here. Most of the time for people who have diarrhea on tube feeding, it's because it's running too fast and we need to slow it down and give their GI tract time to accommodate that. So I really like A. That's a very common intervention. B is outside my scope of practice. I can't do that without an order. C is fine, but that's not, you don't do that when you have the option to slow the infusion rate. Check for recent antibiotic use. There's no reason to think that's the problem. I mean, I can check for it. That's fine. There's nothing wrong with checking for it, but that's not a priority here because they told us specifically that they're on tube feeding. So slowing the infusion rate is definitely a priority for someone who has diarrhea when they're on tube feeding. Usually what we do is we slow it down and we gradually increase it back up to the goal rate. A hospice client with a dry mouth requests relief. Which non-pharmacologic measure is most appropriate? Offer frequent sips of water, swish with half-strength hydrogen peroxide, apply petroleum jelly to the lips, use lemon glycerin swabs. Okay, hospice, end of life. They're obviously able to talk. Dry mouth, request relief. They don't tell me they can't swallow, so I like offer frequent sips of water. That's good. Swish with half-strength hydrogen peroxide. I don't know why I would do that. I'm crossing B off. Apply petroleum jelly to the lips. That's going to help with the lips. It's not going to help with the dry mouth, so I'm going to cross that off. Use lemon glycerin swabs. I mean, you can use that. You can do that. So I would offer frequent sips of water, but not use lemon glycerin swabs, or I would use lemon glycerin swabs, but not offer frequent sips of water. Why would I not offer frequent sips of water? Like, it doesn't say they can't drink. It doesn't say they have limitations. So of course, I'm going to use the most fundamental thing that we do when someone has, what do you do when you have a dry mouth? You take sips of water, right? That's fundamental. That's basic care and comfort. A client with fecal impaction is scheduled for digital removal. Which action must the nurse take first? Administer prescribed stool softener, obtain baseline vital signs, position the client in left SIMS, ensure presence of another licensed nurse. Well, they have a prescribed stool softener. I mean, I guess, but that's not going to help with the digital removal. I mean, if the digital removal is using your finger to remove impacted stool, okay? If you don't know what that means, digits, these are your digits, okay? Using your digits to remove impacted stool. You're putting a finger into the rectum. So administer a prescribed stool softener. I mean, I can give that, but it's not going to help with this specific intervention. So I'm going to cross it off. Obtain baseline vital signs. Why would I want to do that? Well, the same reason I suppose they could have a decreased heart rate when they're straining at stool, right? If they're straining at stool, they can Valsalva. So I guess I do need to make sure their heart rate's not too low before I start. Position the client in left SIMS. That's fine. Left or right SIMS is fine. Ensure presence of another licensed nurse. I don't know why I would need that. I don't need another licensed nurse to do digital removal. So do I want to obtain baseline vital signs and then position the client, or position the client and then obtain baseline vital signs? I'm going to get baseline vital signs. Now, you may not have learned about getting baseline vital signs as part of digital impaction. This is why I wanted to go over this question, because you have to use common sense and clinical reasoning. Don't immediately go, oh, well, I don't have to do that. Nobody taught me I have to do that. You have to think through it. Maybe nobody taught you that, but you still have to think through it. And even if nobody taught you that, I bet you would do it anyway. I bet before you went in there and did that, you'd glance at their last set of vital signs? I bet you would, because you would know in the back of your head what you're doing could slow heart rate. And you would glance at it even if nobody taught you that. Okay, so these were not rocket science questions, but they're very good questions to learn how to think clinically, to use clinical reasoning and common sense. Use your common sense, okay? It's not about how much you study, it's about how you think while you're studying. Minimum of 2,000 questions before you take Nclex the first time. If you've already taken Nclex before, make sure that you're using the strategies that I'm teaching you for how to think, and consider doing the clinic review. I don't make any money off of that online on-demand clinic review, so I can tell you all about it. And I think that's it. So thank you for being a part of our family, and good luck on your Nclex.